Maternity services at private hospitals in Hobart and Darwin are set to close. Hospital operator Healthscope says declining birth rates in Darwin have made their service unviable, while blaming the Hobart closure on a lack of staff. Maternity services at Darwin Private Hospital will be closed from mid-April, while those at Hobart Private Hospital will be closed in August. Well, for more on both of these stories, I'm joined now by the Australian Medical Association President Danielle McMullen. Danielle, good morning. Welcome to ABC News. Let's start with this news out of the Northern Territory and Tasmania. This leaves the Territory with no private maternity care at all, and Tasmania with one hospital in the state. What kind of an impact is that going to have on remaining maternity services in those regions?
It's a really sad day for women's health in these two states. Women deserve choice when they're having their babies, and if you've paid for your private health insurance, you expect that there's a private hospital to be able to have your children. And as you said, in the Northern Territory in particular, there will now be no private offering. So that really is a poor decision by Healthscope, particularly with such short notice. And the impacts both on the public and private down in Hobart, and then on our public service in Darwin, which we know is already so stretched. We heard about that last week. It's really a difficult time ahead for birthing services in both of these states.
What does it mean for expectant mothers who are already pregnant and expecting to use these services over the next few months if these services are wound up before they're due to give birth?
It's a really stressful time for families, and we've already had calls from women and families expecting to give birth at the private hospital in Darwin who now don't know what their options will be. So today is a very uncertain time, and it may mean they have to travel many thousands of kilometres to another major city if they would like to give birth in a private hospital. We really urge Healthscope to delay this removal of services and get back to the table on private health insurance funding more broadly, because clearly this is a sign that our private health system needs more intervention and more oversight to make sure that patients have access to care.
This isn't the first time that private hospitals have wound back these services. Why is it that maternity care is being targeted by cuts like these?
Yeah, we are seeing more and more restriction of services, and it does highlight our broader concerns about private health insurance sector and making sure that patients are getting value for money from their premiums and access to care when they need it, as well as making sure our doctors have hospitals that they can perform their work in. And maternity services are being particularly targeted across the country, and we've seen it here. There's obviously some particular cost and workforce pressures in maternity and obstetric services, and we really need insurers and hospitals and governments to get together urgently on this. There is the private health insurance CEO forum through the Department of Health, and we urge them to consider this matter now and make sure women have access to care.
Yeah, the AMA, we know, has made a submission to that private health CEO forum calling for reform. Can you take us through some of the changes that you say are needed in the private healthcare system?
We do think that, broadly speaking, there needs to be more oversight of the private healthcare system, something like an authority that can have oversight of things like this. These types of disputes shouldn't be happening, and we need a body who's got governance and control over it. On maternity in particular, I think this week's announcement highlights that we haven't quite got the settings right, perhaps on our gold, silver, bronze, or on access to maternity services, if we're finding, or the payments that insurers have to make to hospitals. Given that across a number of states, we're now seeing withdrawal of services, which is not in the best interests of women's healthcare.
And we've been reporting this morning, Danielle, about Healthscope nurses wanting to strike at 8 private hospitals in New South Wales alone. They're seeking a 15% pay rise, but a night shift penalties. Are we seeing here issues with the private health system prioritising profits over patient care?
It's another example of the pressures that the private sector is under and how we haven't got the settings right. We are seeing that insurers have been logging record profits and not necessarily delivering as much back to patient care as we would like to see. We do have calls for insurers to return a minimum of 90% of their premiums back to patient care, and we do think that would go a long way to helping these workforce and access issues that we're seeing.